Hey guys, welcome back to my YouTube video channel. Today I just finished the procedure implant case, and it was tube number 4. I'm going to walk you through the step-by-step how I remove a broken tube number 4, extract it, bone graft, and the implant. So let's jump right in and check it out. If you have any question or comment, please feel free to let me know down below. Subscribe to my channel. See you down this video. Hi guys, so let's take a look. This is tube number 4. You can see the black tube right there, and in the back is a lingual cusp fracture at the gum line, and it's not savable anymore. The tube need to be removed. So first thing I want to do is show you the lower tube. This is how the oral hygiene of the patient on the bottom tube. Now to do this, we first need to evaluate how we approach this to remove this tube atraumatically. So the best thing I would say is to go ahead and cut the buccal cusp away. So I'm about to go ahead and do that. So once you cut the buccal cusp away, you will have a better occlusal view on how your tube anatomy look like. That's where how you going to design your section of the root. That way you can atraumatically remove the tube without causing any bone fracture on the facial aspect or the lingual aspect. So evaluate your occlusion after you occlusal view, after you take out the buccal cusp. So now what I see is some decay left. I still want to clean everything nice so I can see better view. So that's what I'm doing right now, is to continue evaluate my occlusal view. So I just want to see the clean root, clean occlusal root. I don't want to see any decay around. When I see decay, I cannot make the decision how I want to cut it. So to take out atraumatic premolar or anterior, the idea is cutting the root just like you could cut in the birthday cake. You need to cut it nice and clean so you can break piece buccal or lingual or meso or distal nicely. So I'm looking at that. I just did right after that I make the middle meso to distal section of the root. After I did all of that, I remove everything. I skip a little video there. Just go straight to the point where I'm going to use this Alma bone graft material. It's the mixing between liquid and the calcium sulfate material. Very powerful product. You try it, you're gonna love it, because once you put it inside the socket, it's gonna take a few minutes. It's gonna harden the material, and it's just like nice bone material cover up your socket. So I'm mixing it right now. I'm taking the top part, and basically I am going to be ready to inject into my socket here. So right there, as you can see, just push in all the way in, and just use condenser or some tool to take these material inside. My plan is that I have a big socket there. I'm going to not gonna drill my deeper hole, but trying to use the whatever socket land there. I will compress with this Alma bone graft material, and then let it set for a few minutes while I'm looking for the right implant site. And I'm gonna put a lot in here because it's just one-time use, so that's why I'm gonna just compress everything I can. I'm going to use the Nobel Acti 4.3 by 10 millimeter implant. I'm going to use the instrument hand tight instrument to basically screw in the implant. So let's see how it turned out, guys. If we go in, make sure that it's stable. Your angle should be right in the middle of the tube. Sometimes you aim it toward the buccal or toward the lingual, and then you create a little bit of buccal angulation, not buccal angulation, but your coronal part should be toward the buccal, and the lingual, the apical part should be toward the lingual side. So now it's going right in. Rather than put the Hewlin cover screw, I would go ahead and put Hewlin abutment in there. And as you can see, as I work slowly like this, the bone start become hardened right there. The bone graft material start getting hardened. So I'm gonna go ahead and rinse it off. I take my time. I've done this several times like this before. I'm not gonna be in a hurry for anything. The blood is stopped bleeding. So I'm not gonna be worried about blood bleeding or anything like that. Gotta clean your side really well, etch and bond on the adjacent tube so that you can have some temporary crown connected to the adjacent tube and prevent from the dislodge and coming out. I told my patient that this is how it's gonna be for the next few weeks. All I'm asking her is to be careful on this side, and once it's stable, I will be, you can see right there, the bone is inside. It's kind of very solid. It's not mobile. The bone is not mobile, as you can see right there. This is before I do a temporary 3/4 crown around the tube to create the protection of the whatever bone graft material. I don't want to use any type of titanium membrane, or I don't want to use any type of connective tissue graft. I'm using the injectable composite material to cover up this area right here. A few weeks, guys, your gum, patient gum will grow in about 4 weeks. So if the patient can keep up with a few weeks, that will be awesome. I don't expect the patient to have this for a long time. As you can see right now, I just want to show you the previous x-ray, the root right there. And so we take out the root, which we have a challenge to remove the rest of the tip of the root. But finally, I was able to remove, and I was able to place the implant in. Again, thank you for watching, guys. I hope you enjoyed this video. If you have any questions, feel free to ask me on the make some comment and ask me. I would love to share my experience and as well as what I know about immediate implant placement. Thank you again for watching. I hope you have a great day. Bye bye.